The Biden administration is expected to recommend booster shots of the Pfizer and Moderna vaccines for most Americans. Channel 3 Eyewitness News reporter Mike Savino has been asking the experts when you might need to get another shot. He is joining us live from the answer desk. And Mike, what are you hearing about all of this?
Well, there's still a lot of steps that have to be taken before booster shots become available to more people. And one question that doctors have along this way is who else will need them?
We are learning more that people that were vaccinated earlier on now are beginning to have breakthrough infections.
As COVID cases continue to rise, there's more questions about COVID vaccine booster shots. Just last week, the federal government approved booster shots of the Pfizer and Moderna vaccines for some people with weakened immune systems. Now, President Joe Biden is expected to advise that most people get booster shots. So why did last week's approval only focus on the immunocompromised?
The evidence for the immunocompromised was fairly compelling.
The evidence was clear for the immunocompromised, but more information is needed for everyone else. Specifically, who else might need a booster shot? Some studies have found that the elderly didn't get the boost expert wanted when they got the vaccine. But is it because of weaker immune systems, the Delta variant, or is the vaccine waning over time?
We know that immunity in general will wane after a while.
As more information comes in, that will paint a clearer picture of who else needs booster shots. Studies show that the vaccine even now protects against severe cases, but a booster shot could help lower the risk of infection and of spreading the virus if you get it.
By providing that higher level of antibody, there may be less contagiousness to others.
How much of a boost could you actually get from a third shot? Doctors say you should look at the first two shots of the Pfizer and Moderna vaccines as a single treatment, and a booster shot for a vaccine is not uncommon.
Now is the first real time that you're taking those memory B cells, so to speak, and putting them into action.
So should everyone just get a booster shot? No. One portion of the study is looking at the possible side effects for people who don't need one. And then there's the matter of setting priorities for who should get the vaccine.
We have many individuals who haven't received any vaccine doses, and that really still needs to be a priority.
Now, Connecticut has already made vaccines available to the immunocompromised after the CDC's decision. Coming up on Eyewitness News at 6, you'll hear why one local radio host battling cancer finally feels safe because of it. Now, if you have a question about something